All right. So, hi, hello. I'll be your nurse this evening. I am Renee, and I'll be taking care of you this evening. And what is your name
My name is JP,
and your birthday?
10/21/90,
And what brings you in today?
just for a annual checkup.
Okay, all right. When last did you see the doctor?
I think last spring.
Last
just about.
spring. Was there anything that was abnormal? No.
No
Okay.
problem.
Is there any worries now? Any change
No
since the
change.
last time? No change. Everything is good. You're eating right and stuff. You're up to date with your immunizations.
Yes.
Have you had the COVID test?
Yes.
You have that and the COVID vaccine.
Yes.
Two of them.
Yes.
Okay. All right. Did you ever have the COVID? No. All right. Awesome. And do you work currently?
I do work currently.
Okay. And do you live alone?
I don't live alone, no.
Okay. All right. You live with your.
I live with my boyfriend.
Okay. Awesome. Is there any worries? Do you feel safe?
I do feel safe at home.
All right. Awesome. So we're gonna do a head-to-toe assessment, and and we'll go from there.
Okay.
So I'm just gonna wash my hands just from precautions. Wash my hands, and then I'm just gonna make this private, and
Okay.
then I'll go from there. So what is do you know what day is it today? The date?
Today is October 13th.
Okay, good. And the day of the week?
It is Wednesday.
All right, awesome. All right, so I'm gonna take a look at your. I'm gonna take a look at your neck, your head, everything. Make sure everything is in check, and there's your manual. Do you feel any pain there?
No pain.
No pain.
Mm-mm.
Okay. Any pain on your neck?
No pain
That's
in
like-
my neck.
Okay. All right, and then what about for your jaw? Can you do you have any problem with your mouth? Any jaw pain?
No
Maybe
jaw
can-
pain, but my jaw does click a lot.
It does click a lot.
Yeah.
When it clicks, does it hurt you?
This is uncomfortable.
Uncomfortable. When did it start? When did you
Well,
start?
I've had
noticing
this for years.
it? All right.
I tend to grind my teeth at night.
Oh, you do. Have you seen a doctor for it?
Yeah.
You have. And
They,
what
uh,
did they?
They want me to wear a night guard.
Okay. Have you
I'm
been wearing your
not-
night guard? No.
Not really that compliant.
Okay. All right. And you're still having the same problems?
Yeah, but I mean, it doesn't really bother me to the point where I need,
Okay.
attention right now.
And you don't have problem eating?
No problems eating. No.
All right. Well, when last did you see the dentist?
Oh, like a year ago.
Okay. All right. Okay. All right. All right. So I am gonna just take a look at your skin. Well, I'm gonna take a look at your hair to make sure it's even
Okay.
and any bump or anything. So everything is intact.
Okay.
And I will take a look at your fingernails to make sure that. Oh, sorry.
It's okay.
Do you have any problem with your skin, like any dry skin, eczema? You don't get those. All right. And then I will just take a look at your eyes.
Okay.
All right. And I'm gonna use this. All right. Could you open your eye? All right. All right. Awesome. Great. Do you have any eye problems?
No eye problems. I just wear contacts and glasses.
Okay. Has your vision changed? Any change in vision?
A little bit. I need to go to the eye doctor soon.
When last did you go to the eye doctor?
Oh, that was like 2 years ago.
2 years ago. Okay.
Yeah.
All right. So you're gonna see the doctor.
Yeah, I'll definitely make an appointment.
All right. Now can I see your tongue? Okay. And any dental issues other than the okay. All right. Awesome. And then I would see if okay. All right. You don't want to see that. All right. So I am gonna just take a look at your eyes. Any change Are you able to see far away?
Without my glasses, no.
Without
Or like
your
my
glasses?
contacts, yeah.
All right. Okay, so I'm gonna tell you to read something out. All right, you just cover your right eye.
Okay.
Do you have on your contact lens now?
I do.
All right, so cover your right eye, and could you read the letters?
FGB.
Good. And now cover your left, and could you read the letters?
FGB.
Okay. All right. Good. Awesome. And then I would see yeah, any problem with your hearing?
My
Do you have any-
hearing.
yeah.
Sometimes I get ringing in my ears.
You get ringing in your ears?
Yeah.
Okay. How long have you been having that?
Like a month or two.
A month or two. Have you seen a doctor for it?
No, I haven't. I will though.
Is it hurting you?
No, it's not hurting
Just the
me.
ringing?
It just like when I'm in like a really quiet room, I
Uh-huh.
can definitely like hear it. But when I'm like out and about doing stuff, I don't really notice it.
Okay.
Yeah.
So when the ringing comes, when does it occur? When does it happen?
When I'm like mostly, I don't know. I mean, if I focus on it, I can hear it right now.
Oh, you can ring.
Yeah. But otherwise, if there's surrounding noise, I don't really notice it.
Yeah. You should see someone for that to see what's going on.
I will.
Do you have anything coming out from you? Any drains or any drainage? Nothing. All right. And do you have any other thing? Like, do you have problem hearing other than the no?
No.
All right. So and now, okay, I don't have my stethoscope on me, but I can, definitely you seem to be breathing fine. You don't have problem with your breathing. No abnormal, no wheezing, no crackles. And I am gonna take your blood. I'm gonna take your blood pressure.
Okay. Thank you, Ken.
Then I have something for you just to take your pulse ox. Oops. Okay. Okay, so it's 99%. Do you have any problem eating? Do you have any loss of appetite?
No loss of appetite.
And no recent gain. Is there any recent weight gain or weight loss?
No.
No. Okay, so it's 127/81. And heart rate of 77. Right. Do you know what your baseline is for your blood pressure?
Around there.
Around there.
Yeah. It's never really too high. Like at most it'll go 130.
Do you have any chest pain?
No chest pain.
No chest pain. Do you get have you ever had any chest pain? Do you get chest pain or have palpitations?
Sometimes. Yeah.
Like how long have you been getting those?
I mean, once in a while, like, I'll start to feel it if I smoke a cigarette.
Okay, all right. So just smoking is not healthy. It's bad for it's not good for your lungs. It's not good for your heart. So you definitely want to cut down on that. And then I will I'll listen to you just to make sure. Do you have any numbness or tingling? Okay. Alright. And then Alright, so your neck is okay, your neck is fine. Do you have any family history of heart problems?
Just high blood pressure.
High blood
My
pressure from
mom's
your
side.
dad? Your mom?
Yeah.
Does your mom does your you say your mom has high blood pressure, hypertension? Does she take any meds for it?
She takes a diuretic.
Oh, she takes that, right? Okay. What about your dad?
Um, my dad has no health problems actually.
Okay. Any diabetes in the family?
No.
No diabetes in the
Not that
Do you
I'm
have any
aware of.
thyroid issue?
No.
No thyroid issue? Alright. Okay, and then I'm just gonna take a look at your tummy. So if you want to stand up for that.
Okay.
And I'm just gonna start press over your. Is it hurting?
No hurt.
Okay. Any so like in terms of your bowel regimen, how often do you go to the bath? How often do you have a bowel movement?
It depends. Like 1 to 3 days.
1 to 3 days. When was your last BM?
Today.
Today. Alright. So you don't take anything for stool?
Just a coffee usually. It's
Okay.
enough.
And have you been having any issue with the urinary system? Alright, okay. Do you get any burns while you're peeing, voiding? Alright. Okay, then I'm gonna take a look at your legs. So if you can just good.
My leg.
Alright. Does it hurt?
Painful. No, it
No?
doesn't.
Alright, and this and your
I don't
next
know.
leg? Alright. Good.
Okay.
Alright, and then can you raise up your right leg?
I can. I mean,
Alright.
do you want a video?
Don't worry,
Okay.
yeah, don't worry. Your
Raise
right
up my
leg.
leg.
And your left.
My left.
Alright, okay. Alright, so you can sit down.
Okay.
Alright. And have you had any surgery in the past?
Yes. I
What
had my right ankle had surgery.
Oh, what did you have surgery for? Your right ankle?
Yeah.
Oh, what happened?
I broke it.
Okay.
Like a scooter.
Oh, scooter. Oh,
Yeah.
wow. I'm sorry.
That's okay.
Scooter.
Yeah, these
And what did
scooters
they
right
have
here.
to do? Oh, wow. What did they have to do on it? What
They
surgery
did 3 screws and a plate.
Oh, 3 screws. And when was this?
It was June 2019.
And is it okay? Do you have any problem with it?
I do have pain once in a while.
Okay.
Yeah. Especially like after work. I
When
definitely
you
feel
stand
it.
for lunch?
Yeah.
Okay. Is there any other health issue that you have?
No, not at the moment.
Okay. And then can you I'm just gonna check your hand or your arms. If you can stretch it, and then if you can just bend, lift both of them up. All right. And if you can flex it. Yes. All right. Does it hurt?
Doesn't hurt.
It doesn't hurt. Okay. And now, is there any pain when you stretch it? When you raise
Can I
it
go
up?
like this? No,
Yeah.
no pain.
All right. Okay. And then can you do like your wrist? Can you like abduct or abduct? Can you like okay? Can you like do this on your arm? Okay. All right. Does it hurt you? And do it on the other one. Okay. All right. No hurt.
No hurt.
All right. Okay. And is your hips? Do you have any problem with your hips?
No, no problem.
Do you normally exercise?
No, not really.
You don't exercise? Okay. How come don't you exercise?
Uh,
How come don't you exercise?
I can be a little lazy. I mean,
Alright.
I walk my dog. That's the extent of my exercise. really.
Okay. All right. And in terms of your eating habit, how do you eat properly? Do you eat well? You do? Okay. And now I just want you to walk on your heels.
Okay.
Your heels. And then walk on your toes. All right. Okay. Awesome. And now I just need you to put your finger to your nose. All right. the other finger to your nose. All right, and then and um, and then run your heel down to your shin. So run good, and the other leg. Any pain? No pain. All right, and so I'm just gonna ask you if you can count to five. Count five from like 1 to 50.
Probably 5,
Yeah,
10,
yeah,
15, 20,
yeah. Okay.
25, 30, 35, 40, 45, 50.
All right, awesome, good job. And now I am going to ask you just to, I'm gonna say four things. I'm gonna call out four words, and I need you to like repeat those four words to me. All right, so pizza, bread, mall, and fries.
Pizza, bread, malt, and fries.
Good. All right, awesome. All right, and when did you celebrate your last? What did you do on your last birthday?
I stayed home.
You stayed home. Okay. All right, and what is your you I heard you say something about smoking. When you smoke, you get the chest palpitation.
Just like a little chest pain.
All right. How long have you been smoking?
For like 8 years.
Okay. And how many packs of cigarettes do you smoke a day?
I smoke like, I mean, I'm not continuous, so like socially, and if
Socially?
yeah, and I'll smoke like probably 2 or 3 cigarettes at most in a day.
Okay, so in a week, how many do you?
So in a week, maybe like I haven't been smoking much lately, but like 3 or 4 cigarettes a week.
A week.
Yeah.
And and then that's when you get your chest pain.
Yeah,
It
but
just-
yeah, it happens once in a while. Not all the time.
Okay, all right. And do you plan on quitting?
I do.
You do plan on quitting?
Yeah.
Well, it's very important for you to stop smoking because you know what it can do to your health and
Yes.
you know all the dangers. So it would be good for you to go. You know, I can bring like a smoking cessation, something for you to go over. And do you drink alcohol?
I don't drink alcohol.
You don't drink at all?
Not like socially, like if I go
Social.
out. But,
When was your last drink?
like a month ago.
Last one. And do you do any drugs, illicit drugs?
Marijuana once in a while. Marijuana.
Oh, okay. And when was your last marijuana?
Like last week.
Last week? Okay. Alright. When you smoke, when you do marijuana, do you get the chest pain also? You don't? Alright. So your last drink was last month?
Yeah.
Last month. Okay. So it's good for us to like go over like you quitting smoking and stuff, especially with the chest pain that you've been getting. And it's good that you're aware of it. And also, do you feel safe at home? Do you feel safe?
I do.
You do. Do you have any anxiety or depression?
Yeah, I get anxiety. and
Anxiety.
depression.
Okay. Do you take anything for them?
No, I don't.
Any attempts to suicide?
No.
Any suicide attempt? And do you have family members? Are you have like social? Do you have like anyone around?
Yeah, I have family around.
Okay. All right. And so is there anything that you need any clarification on? Any question? All right. So I'm just gonna go over like smoking cessation, with you. I'm gonna give you a booklet to go over that, and it will be good for you to stop. So this way the chest pain can can go down. Your blood pressure of 127/81 is good, but we don't want it to go over that. And you have your pulse ox is excellent, 99%. Do you have any asthma, COPD, anything? Okay. So your mom is just high blood pressure,
Yes.
and your dad has nothing.
Nothing.
Any high do you have gout or anything?
Gout? No gout.
No gout. Okay. All right. All right. So, all right. Thank you. Thank you very much.
Thank you.
All right. Bye.